Hello everyone. So today I am going to discuss about the clinical scenario based MCQs. These MCQs have been already there in a university exam of anatomy. So out of the whole paper, these 6 important MCQs were there in the university paper. So I will discuss each and every question here one by one. So this was the first question asked in the exam. A young man, while speeding his motorcycle, met with an unfortunate accident and there is a fracture his upper arm. Now, when you will see the X-ray done in emergency revealed the fracture of mid-shaft of humerus. So, dear students, as soon as you will see this word mid-shaft of humerus, your mind should go towards the radial groove because radial groove is a location in the mid-shaft, and whenever there is a mid-shaft fracture, the only nerve which you have to keep in mind is radial nerve. So, which nerve is likely to get injured? Answer is radial nerve. Clear? So, mid-shaft word comes means we are discussing about the spiral groove, or it is also known as radial groove, lies on the posterior surface of humerus. Now, this is the second question. It was there. A 30-year-old lady had a road traffic accident and fractured her right clavicle. So, there is a fracture of the clavicle. Now, this is your clavicle bone. Now, when you will have the fracture of the clavicle, now this fracture is here. Clear? That is the junction of middle and lateral one-third of the clavicle. X-ray shows overlapping of the two fragments. That means these two fragments are not in one line. There is a overlapping like this. So one fragment is down, other is so there is a overlapping of the fragments. Which of these muscle causes upward displacement of the medial fragment? That means this medial fragment pulled upward by the action of which muscle? Now when you will see the deltoid, if you will go from below upward, deltoid attached on the lateral side, so it should not be the answer. Pectoralis major attached on the this part on the anterior border, but it is having the attachment like this. It cannot pull in upward direction, so it is not the answer. Serratus anterior has to do nothing with the clavicle, so it should not be the answer. So answer is sternocleidomastoid. Now the other way to answer this question, you know that sternocleidomastoid is having external fibers which are arising from this medial side of the clavicle. So whenever the fracture is there, some contraction of the sternocleidomastoid is definitely responsible for this displacement. So answer is sternocleidomastoid. A young man with a penetrating injury to the posterior triangle of neck, unable to shrug his shoulder and turn the head to opposite side, which of the following structure is most likely damaged? Now dear students, this question may be in the head and neck, but here when we are talking about the movements of the shoulder, there is a the patient is not able to do the shrugging of the shoulder. Shrugging means this is the shrugging of the shoulder. So this shrugging is possible because you will have the muscle is trapezius. It pulls the both shoulder in upward direction. Now this shrugging is possible because of trapezius, which is supplied by the spinal accessory nerve, and this spinal accessory nerve is the nerve which is most commonly damaged into the posterior triangle of the neck. So whenever you have this word posterior triangle of the neck, you always try to think about the spinal accessory nerve injuries. Now we'll move to the next question. A bank manager presents with the complaint of inability to flex her proximal interphalangeal joint. Now dear students, you know that there is a three phalanges: distal, this is the middle, and this is the proximal. Clear? Now these are the two interphalangeal joint. This is distal interphalangeal joint, this is proximal interphalangeal joint. Now which joint is not moving? This proximal interphalangeal joint is not moving. So which of the following muscle may be functionally deranged? Now dear students, here you have to keep this thing in mind that there is a one tendon which is approaching this distal phalanx. Now this is the tendon of flexor digitorum profundus. When you will have the flexor digitorum superficialis, this flexor digitorum superficialis first split and then it will attach here. So this is the pattern of flexor digitorum superficialis, and this is the tendon of flexor digitorum profundus. So this proximal interphalangeal joint is not functioning. That means it is purely the action of flexor digitorum superficialis tendon. The profundus tendon is longer enough, which will insert on the distal phalanx, and it moves the distal IP joint. So, but question is about the proximal IP joint. So I will go with the flexor digitorum superficialis. So flexor digitorum superficialis is inserting into the middle phalanx, and it is mainly responsible for the flexion of PIP. Now we'll move to the next question, that a patient is asked to grasp a thin book firmly between the thumb and index finger. Now this is a classical sign, is known as Froment sign. Now in the Froment sign, we ask the patient to hold the book or some paper between the thumb and other fingers. Now this is to test the one very important muscle, and that muscle is causes adduction of this thumb, and that is adductor pollicis. And you know that adductor pollicis is supplied by the ulnar nerve. So which nerve is being tested? Answer is ulnar nerve. Now here you have to keep this thing in mind, that whenever we are talking about the muscles of the small muscles of hand, you have to keep this thing in mind. There are 20 muscles, out of which 5 muscles are supplied by the median nerve, remaining 15 are supplied by the ulnar nerve. Now which these 5 muscles are there? So one is your flexor pollicis brevis, abductor pollicis brevis, opponensis pollicis, and first and second lumbricals. So these 5 are supplied by median nerve, remaining all supplied by the ulnar nerve, and the adductor pollicis, which is supplied by ulnar nerve, is known as graveyard muscle of the graveyard muscle for the ulnar nerve. What does it means? That ulnar nerve will terminate and it ends into the adductor pollicis. Now this was the last question from upper limb in the paper. A 27-year-old man with cubital tunnel. Now see, the word itself now specify the nerve injury. Now where is the cubital tunnel? Cubital tunnel is seen behind the medial epicondyle of humerus, and here you have the nerve is ulnar nerve. So we are dealing with the question related to the ulnar nerve compression. If this patient complained of numbness and tingling in the ring and little finger. So this area is supplied by the ulnar nerve. So ring and little finger, these two fingers are also having the tingling and numbness because of the injury at elbow. Which of the following muscle is most likely paralyzed? So you are dealing with the ulnar nerve first. Now you have to find out which muscle is supplied by ulnar nerve. Flexor digitorum superficialis, no, it is supplied by median nerve. Opponensis pollicis, I told you, out of the 15, only 5 muscles supplied by the median nerve, out of which opponensis pollicis is again supplied by the median nerve. Medial 2 lumbricals, yes, these are the 2 lumbricals which are supplied by the ulnar nerve, and lateral 2 lumbricals, no, these are again supplied by the median nerve. So 4 names are here: flexor digitorum superficialis, opponensis pollicis, and first and second lumbricals. All these 3 options for the median nerve, the only option left for the ulnar nerve is medial 2 lumbricals. Clear? So these were the 6-7 questions in the paper from the your ulnar upper limb anatomy. Clear? So whenever you are reading this upper limb, you have to keep this thing in mind, that the clinical scenario based questions may be asked in such forms. Clear? So I am also giving such ideas for you. There are multiple videos which I have already been uploaded, so you can go and see in the member only list where you will find such videos. You can scan the QR code here for the notes, and you can revise these questions fastly from this video. So this is all for the session. Thank you and good night.